Hi, everyone, and welcome back to another episode of Mindful Marathon Conversations. I'm your host, Dr. Michelle Quirk. I'm a pediatrician and a run coach, and the founder of Mindful Marathon, where I help make running easy and fun for busy professionals. And today I have a very special guest with me. I'm very excited to introduce everyone to Dr. Cheruba Prabakar. Dr. Cheruba, welcome to the show, and tell everybody a little bit about yourself.
Yes, thank you so much for having me. This is so great. Really excited to be here. I am Dr. Prabakar. I am a board certified OBGYN. And after my residency, I did a 2-year fellowship in minimally invasive surgery. So I do a lot of pelvic surgery, laparoscopic, robotic surgery, and I practiced full scope OBGYN for many years. And then recently started my own private practice in the Bay Area in California, where I specialize in gynecologic care and specifically pelvic floor issues and surgery related to that.
Yeah, and so I think, your special interest in what you do every day with the pelvic floor is why I wanted to have Dr. Cheruba come and meet all of you, because I do get quite a lot of questions about running while pregnant and postpartum, and then pelvic floor issues in the future. And so we thought we would dive into that topic, at least do a part one. I'm not
Yes.
sure, it may require a part two at some point, but we'll start there. So maybe in your experience, what are the most common issues that runners may have, or that you have seen women for with the pelvic floor?
Yes. So the pelvic floor is so complex. And I don't think I quite appreciated that until I became a mom myself. And then when I opened my practice, seeing more and more patients with these issues, it is really a very complex thing. And it is a group of muscles and ligaments that hold the pelvic floor together. And these can be stretched for a number of reasons. Sometimes it's injury, but the most common reason is childbirth. So women who have kids then start to have some issues with pelvic floor dysfunction. And that can even be vaginal delivery or a C-section. It's actually a common myth out there that, oh, only if you have vaginal deliveries will you have pelvic floor issues. But actually, the bottom line is the pelvic floor has been stretched regardless during pregnancy. So a lot of that dysfunction can follow even after a C-section. And then many women will say, like, oh, when I run now, I feel like there's a bulge in my vagina or a bulge coming out between my legs. Or they'll say, oh, I think I'm like peeing myself, like I'm peeing my pants. Um, or they'll say, like, well, I can't really do this long run that I used to. I just have to run for a little bit. And then I feel like this intense urge to run to the bathroom. And if I don't make it, I'm going to pee my pants. So I'm not sure if these are some of the things you've heard, but some variation of these three complaints are what I hear in the office.
Yeah, usually it's the urinary complaints more than the bulge, but that's just in my own, my small sample size of women I've worked
Yeah.
with. But it really, it's impacting their ability to enjoy the run, and also goals that they may have had, before all of this, with long runs or half marathons, full marathons. Like the longer the distance, it seems like that is just a really tough thing, especially if you need to stop and go to the bathroom every 20 or 30 minutes.
Exactly. And a lot of women then don't want to do hikes with their family. And they're starting to plan all of their activities around this, like, oh, where is the closest bathroom situation, which is, really impacting what they want to do on a daily basis. So I think this is a common issue. There's also issues with maybe running down inclines. I've also heard of that from some patients, where running on flat roads are fine, but then when they start to go down a hill, for example,
Mm.
then they'll start to pee more. And I think the bottom line that I try to tell patients is this is more common than you think. As a gynecologist, of course, I see it as a runner and as a run coach. you probably hear about it. But this is more common than most women think. And of course, it's embarrassing to many. So a lot of us don't want to talk about it, but it's definitely out there. And there are things that you can do and get help with.
Yeah, I mean, that's really why I was most interested to talk with you, because it's something that I hear commonly, but also no one really talks about it. And I do think maybe this is a special, a place that we hold because we're both physicians. And so I can kind of bridge the gap because I'm a physician and a run coach. And so that's great. So we can at least open the conversation, but it's definitely something that a lot of women don't want to talk about.
Yes, and some think it's just normal. I've had patients tell me that, like, oh, well, that's just normal. I figured. And while it may be more common as we age or as we have kids, it's certainly not a normal part of life. And so I try to let patients know, okay, we don't want to normalize this. Let's see what we can do to actually improve our quality of life.
Yeah. Well, maybe can you give us sort of like a step 1, 2, 3? I mean, I have in my mind maybe what to do, but if I have runners who come to me with this, what should I tell them to do besides come and see you? But if they're not in the Bay Area.
Yes. So number one, please see a gynecologist. Of course, I would love to see anybody who's in the Bay Area, but wherever you are, make sure you see a gynecologist. I am so surprised at how many people just don't go to the OBGYN after they've had kids. They're like, oh yeah, I had my babies and that's it. And now it's like 5 years out and they haven't seen a gynecologist. And so during a GYN exam, we can really appreciate changes in your bladder, changes in your rectum, or your urethra, and that are all contributing to these symptoms. So that's the first thing. And the second thing is seek out a pelvic floor therapist. Now, I didn't even know that whole specialty existed until I graduated from residency. And to be fair, it's a fairly new thing, pelvic floor therapy, but more therapists are cropping up across the country, which is good. And we need therapy and rehabilitation for those pelvic floor muscles after childbirth, for example. And so if you're having these issues, seek a pelvic floor therapist and they'll be able to do an exam and let you know, are your muscles too tight? Are your muscles too loose? Like what's happening? Where's there a problem? And give you specific exercises for that. Number three, you can use for those who are leaking urine, you can use it's called a Poise Impressa tampon that you can actually get over the counter at any, Walgreens or CVS. And that changes when you put that in, it's like a little fan that opens up in there.
Okay.
And it changes the angle of the urethra and prevents you from leaking urine. So for short runs and activities like that, that's something that you can also consider. And I would definitely talk to your gynecologist about it, but that is another option out there. And if you've done all of these things, nothing's working, then at that point, I would see a urogynecologist who's a gynecologist who's done extra training in the pelvic floor. And we have different procedures and medications that we can use for incontinence, and then some procedures for prolapse as well.
Wow. Yeah, oh my goodness, great advice. Can we go back to the pelvic floor physical therapy?
Yes.
I had not heard of this either until more recently, like last couple of years. How does it kind of depend? I'm going to ask, like, how long is a treatment cycle? Like, do you have to go sort of once a week for, I don't know, 3 months, 6 months, or does it depend on the person and what the issue is?
Yeah, that's a great question. It's about 6 weeks. Or so it's 6 times. So you could do that weekly. A lot of times I see it spaced out, maybe every couple of weeks. So you get to actually put into practice what they've asked you to do and what exercises they've asked you to do. So it's not a huge commitment in terms of, time.
Yeah.
It's 6 sessions, you learn the things, then you do the things. The compliance is hard. A lot of people do all the things in the 6 weeks and then they forget about it. But really sticking with it and keeping that going is great. And another resource that I wanted to share with your audience is the Every Mother app. Have you heard of that?
No.
Okay, so it's an app called Every Mother, and it has goes through, and you don't really have to be a mother to, use this app, but it's the whole idea is rehab for the pelvic floor, and it's amazing. And it goes through, you can tailor it, based on what symptoms you're feeling, maybe the urinary your incontinence, or maybe it's the prolapse, or maybe just some pelvic pain. And then they give you specific exercises, and it's really quite good. And so in conjunction with a pelvic floor therapist, this app is really awesome to do as well.
Oh, that's great advice. Thank you. I hadn't heard of the app. And I think
Yeah.
most of my runners will definitely be familiar with physical therapy. I think any number of us have gone through PT for various injuries in the past, and
Yes.
compliance is always the key. It's like while you are going and you have that accountability to meet with the therapist, it's great. But then once you're sort of released from the program, you have to keep up with your exercises.
Exactly, exactly. And that's where Every Mother is, it's also nice because you click on a day, it tells you what to do. And there's pelvic floor exercises as well as a general kind of core body exercise. And we all know that it's all related, right? Your core and your pelvic floor. So that's what I like about this app too. It's kind of a little more, gives you a little bit more for that. And so, yes, something to definitely look into. And depending on where you are in the country, some patients have told me like their gynecologist has not offered it. So just
Mm,
ask. You can even find this information through your insurance,
mhm.
as to who covers pelvic floor, offers pelvic floor services. And now there's online resources as well on social media. Just a lot of different things you can pick up. And the good thing about pelvic floor therapists therapy is that they also go over some mind body work. So it's not just like physical work, but how can you overcome some of these feelings of incontinence, and how can you not, you know yeah, just going through that loop, and how you
Mhm, mhm.
think about it. I thought was really interesting. I've been through it myself. I have 3 kids, and so
Yeah.
I went to pelvic PT myself, and I was like, I didn't know they did all this. So it was good.
Yeah, no, this is great. You know that at Mindful Marathon, right? Like I want running to be available to everyone. And I think that this was perhaps an unforeseen hurdle for me that I just was not aware of. And I think it's because women don't talk about it as much. And so now over the course of years, it has really opened up and at least we're talking about it. So I'm hopeful that this will maybe spark some conversations and maybe just feel empowered that you're not alone and that there are plenty of pelvic floor physical therapists and plenty of urogynecologists and OBGYNs who would be happy to
Yes.
see you and help you.
Yes, and there's so many angles that you can tackle this problem with too. I mean, there's breath work, there is diet. There are some foods that are particular bladder irritants, and so there's a lot that, if you really start to think about it, there's a lot that we can do. And so
Mhm.
that's the message I think, like you, I want to give to other women, is that yeah, we can. You don't have to necessarily live with these problems. You can actually get back to running and doing the activities that you love.
Yeah, yeah. Well, I think maybe we'll leave it there. Let's see what questions, the audience has after we get this out there, and then we can always do a part two and go deeper.
Oh,
So maybe
great.
tell everybody again where they can find you and if they live in the Bay Area, how they can see you.
Yes. So my practice is called Lamorinda Gynecology and Surgery. And the easiest way to find me is just on social media. I am the fibroid doc, across TikTok, Instagram, and YouTube.
Great. And I will leave those links too below.
Yeah.
Well,
Awesome.
yeah, thank you so much for joining us and for sharing your knowledge. This was great.
Thank you so much for having me.
Yeah, and thanks everybody for listening, and we'll see you next time.
Bye.
Thank you so much for joining us for this episode. If you liked it, please subscribe and share it with a friend. And if you are a newer runner or a runner who hasn't run in a while and you're looking to get back into the sport, you can find out how to work with me over on my website, which is mindful-marathon.com. See you on the next episode.